turning 65 and you're still working, one of the biggest questions that you'll face is, should I stay on my employer's health insurance or switch to Medicare? The answer isn't the same for everyone. In some situations, switching to Medicare could save you thousands of dollars each year or offer coverage that's better than what your employer offers. In other situations, staying on your employer coverage could keep your out-of-pocket cost lower. It depends entirely on your plan and what's available in your area. Today, we're going to show you what to look for and how to get help. Hi, my name is Hannah Skinner with the Senior Savings Network, and today we're going to be joined by my colleague who formerly worked in employee benefits, Elisa Peinado. She's going to compare both options side by side so you can see exactly what to look for in your own plan before making this huge healthcare decision. Make sure to comment any questions below and subscribe to our channel to stay updated on all things Medicare and retirement. And if you need help, call us. Our services are completely free.
Hi, my name is Elisa Peinado, and I'm a licensed insurance agent at the Senior Savings Network. My career started in employer benefits, working with large companies, public sector accounts, and government accounts. I moved into the Medicare space around 10 years ago, so I have plenty of experience in both types of coverage and look forward to comparing the two with you today. Today, we want to help answer some very common questions that we receive when people are nearing Medicare age and they're still working. Should I stay on my group coverage since I'm working past 65, or do I join Medicare now? Is it more cost effective to stay on my spouse's work coverage or be on Medicare? Does my plan at work have better benefits than a private Medicare plan? The goal of this video is to help you understand the difference between employer coverage and Medicare coverage so that you can decide which kind of coverage is best for you to take. First, there are two different types of employer coverage. This is something most people don't realize. Employer health insurance after age 65 generally falls into one of two categories: active employee coverage and retiree health benefits. Active employee coverage is coverage you receive because you or your spouse are still actively working. This is what we will be discussing today. If your employer has 20 or more employees, you usually do not have to enroll in a Medicare Part B while you're covered under that plan. This is called credible coverage. You'll also avoid any late enrollment penalties as long as you enroll when that coverage eventually ends. For large employer groups, the employer often pays at least 50% of the monthly premium for the employee, and some employers even pay up to 100% of the premium for the employee, although they may require spouses and dependents to pay more of their own costs. Retiree health benefits are completely different. Retiree benefits are typically offered by state employers, federal employers, city governments, union employer groups, and large public employers. These plans continue after retirement, but usually require that you enroll in Medicare Parts A and B when you turn 65. We will be discussing retiree benefits in a separate video on our channel. Before we start comparing employer coverage to Medicare, it's important to understand how employer health insurance works once you turn 65. One of the biggest misconceptions we hear is that your employer health insurance automatically ends when you become eligible for Medicare. That's simply not true. For many Americans, especially those working for large employers, your employer health plan continues to work the same way it always has. You still receive your health insurance through your employer. Your employer continues to pay a portion of your monthly premium, and you continue using the same provider network, paying the same deductibles, co-pays, and co-insurance, and following the same rules for referrals and prior authorizations. In other words, simply turning 65 doesn't automatically change your employee health benefits. The biggest question is, does Medicare need to be added to the picture? And the answer depends largely on whether you're still actively working or whether you're considering retiring. If you're still working and covered under a large employer health plan with 20 or more employees, your employer health insurance generally remains your primary coverage. That means your employer plan continues to pay your medical claims first, just as it did before you turned 65. It also means that you will continue to pay your premium for the employer plan which could cost you thousands per year. Because your employer coverage is still primary, many people choose to delay enrolling in Medicare Part B. This allows them to continue using their employer benefits without paying the additional monthly Part B premium while they're still employed. In many cases, you can simply continue using your employer health insurance exactly as you have been until you're ready to retire. And many people ask whether they should enroll in Medicare Part A while they're still working. Since most people don't pay a monthly premium for Part A, some choose to enroll. However, if you're contributing to a health savings account or HSA, enrolling in any part of Medicare, including premium-free Part A, generally means you can no longer make new HSA contributions. Because of that, it's important to understand how enrolling in Medicare could affect your employer benefits and tax advantage accounts before making that decision. If you're covered under your spouse's employer plan, the same general rules usually apply. If your spouse works for a large employer and you're covered under that employer's health plan, you may also be able to delay Part B without penalty until that employer coverage ends. Again, your employer coverage continues functioning as your primary insurance during that time. The important thing to remember is that turning 65 doesn't automatically mean you should cancel your employer health insurance or immediately enroll in every part of Medicare. But in some cases, enrolling in Medicare could save you thousands a year. That's why it's important to look at how much each family member costs individually, rather than just looking at the total amount deducted from your paycheck. So for example, it may make financial sense for you to stay on your employer plan while your spouse enrolls in Medicare. Every situation is different, so it's worth comparing the numbers before making a decision. Now that we've talked about how active employee benefits work, let's look at an actual employer health plan so you can see what these benefits look like in the real world. For this example, we've chosen a mid-level Anthem HMO plan offered through a state health benefit plan. This isn't meant to recommend one plan over another. It's simply a good example of the type of coverage many retirees and active employees may have through a large employer. This is an HMO, which stands for Health Maintenance Organization. If you've never had an HMO before, here's what that means. Your primary care doctor becomes your gatekeeper of your health care. They coordinate your medical care and typically need to refer you to specialists before your insurance will cover those visits. Another important thing to know is that HMOs generally require you to stay within the plan's provider network. If you choose to see a doctor or specialist outside of that network, your services usually won't be covered, unless it's a true emergency. You would likely be responsible for paying the full cost yourself. Like many employer health plans, you'll pay for many healthcare services yourself until you satisfy your annual deductible. That includes things like doctor visits, lab work, imaging, and hospital services. For this particular plan, the annual deductible is $1,300 for an individual or $1,950 if you're covering yourself and your spouse. Once you've met that deductible, the plan begins sharing costs with you through co-insurance. For most outpatient medical services, you'll pay 20% of the cost, while the insurance company pays the remaining 80%. On this plan, you would pay $35 to see your primary care physician, $45 to see a specialist, and $25 for an urgent care visit, $200 for an emergency room visit if you're treated and released, and if you're admitted to the hospital, different cost-sharing rules apply. And below, you can see how it compares to a Medicare Advantage PPO plan. Now let's talk about hospital stays, because this is where many people can experience the highest out-of-pocket costs. On this plan, after you've met your deductible, you'll still be responsible for 20% of the cost of your hospitalization. For this plan, the annual maximum out-of-pocket is $4,000 for an individual or $6,500 for a family. Once you've reached that limit, the plan generally pays 100% of your covered medical expenses for the remainder of the year. One of the biggest misconceptions we hear is, I already have health insurance, so I'm fully covered. The reality is that every health plan has gaps. Whether you stay on employer coverage or enroll in Medicare, unexpected medical events can still leave you with significant out-of-pocket costs. For example, a serious illness like cancer, a heart attack, or stroke can create expenses that go well beyond your medical deductible. You may have costs for advanced imaging like MRIs and CT scans, extended treatment, transportation to appointments, or help recovering at home after a hospitalization. That's why we encourage people to think beyond just their major medical coverage. Depending on your situation, additional protection may make sense. For example, a hospital indemnity plan can help pay for out-of-pocket costs associated with an unexpected hospital stay. A cancer insurance policy can help with expenses related to cancer treatments, advanced imaging, transportation, lodging, and certain recovery costs. Short-term care, a home health care insurance, can help pay for caregivers or home health aides if you're recovering from a stroke, heart attack, surgery, or any major medical event and need assistance at home. These types of policies often have affordable monthly premiums and can help protect your savings when you experience a serious health event. They're not the right fit for everyone, but they're worth discussing before you need them, not after. In addition to medical coverage, this employer plan also includes a few extra benefits. Members receive a gym membership, limited vision coverage, and hearing benefits. The vision benefit covers one routine eye exam every 2 years, although it does not provide coverage for eyeglasses. For hearing services, the plan provides up to $3,000 every 4 years towards hearing-related expenses. So with all of that in mind, you may be wondering, why would someone choose to move to Medicare instead of staying on their employer coverage? Well, the truth is, for many people, moving to a Medicare with a supplement or a Medicare Advantage plan can be the better financial decision. It really depends on your employer's benefits, how much they're contributing toward your coverage, and your individual healthcare needs. The good news is that you don't have to make this decision on your own. Our consultations are completely free, and we're happy to help you compare your employer coverage to the Medicare plans available in your area. Now let's compare this employer plan to an individual Medicare Advantage plan so you can see how the benefits and the costs stack up side by side. We are comparing Medicare Advantage for the purposes of this video because Medicare Advantage plans typically mirror employer coverage. For this example, we've selected a Medicare Advantage PPO plan available in the same zip code. Again, this isn't meant to recommend a specific insurance company or plan. We're simply using a real plan to help illustrate how Medicare Advantage benefits can compare to employer coverage. And the first thing you'll probably notice is the monthly premium. This particular plan has 0 monthly premium. Now, it's important to remember that 0 doesn't mean free. To enroll in any Medicare Advantage plan, you must still be enrolled in Medicare Parts A and B, which means you'll continue to pay your monthly Medicare Part B premium. However, the plan itself doesn't charge an additional monthly premium. Another major difference is the deductible. Unlike the employer plan we just reviewed, this Medicare Advantage plan has 0 medical deductible. That means covered medical services begin immediately, without first having to satisfy a deductible. And your doctor visit copays are also lower. You'll pay 0 to see your primary care physician, $10 to see an in-network specialist, $15 to see an out-of-network specialist, and this plan is also a PPO, or Preferred Provider Organization. Unlike an HMO, a PPO gives you more flexibility because you can receive care from providers outside the network. While you usually pay less when you stay in-network, you'll still have coverage if you choose a provider out-of-network. That's an important distinction for people who want greater flexibility when choosing their doctors. The prescription drug benefit is also structured differently. For medications that are included on the plan's formulary, there is no prescription drug deductible, allowing coverage to begin immediately for those medications. Like many Medicare Advantage plans, this plan also includes several extra benefits that original Medicare does not cover. Those include a gym membership to help support your overall health and wellness, up to $1,500 in comprehensive dental benefits, vision coverage that includes a $300 annual allowance towards eyeglass frames along with the routine vision care, and up to $2,000 each year towards hearing benefits, and travel benefits that can provide additional peace of mind when you're away from home. As you can see, this Medicare Advantage plan offers several attractive features, including lower routine copays, a $0 medical deductible, and a number of supplemental benefits that many employer plans either don't include or offer in smaller amounts. However, just like the employer plan we reviewed, Medicare Advantage plans also have their own strengths and weaknesses. Now let's look at the other side of the equation. While Medicare Advantage plans often have lower upfront costs and valuable extra benefits, there are some important trade-offs you should understand before enrolling. The first thing to consider is your maximum out-of-pocket limit. This plan has an in-network maximum out-of-pocket of $6,700 for covered medical services. While that protects you from unlimited medical expenses, it's significantly higher than the employer group plan we just reviewed. If you have a year with extensive medical care, you could end up spending considerably more out of pocket before reaching that limit. You also have to pay your Medicare Part B premium. Even though this Medicare Advantage plan has a $0 monthly premium, it isn't truly free. To be enrolled in any Medicare Advantage or Medicare Supplement plan, you must first be enrolled in Medicare Part B. For 2026, the standard Medicare Part B premium is $202.90 per month, which comes out to approximately $2,434.80 per year for most beneficiaries. That's an important cost to include when comparing Medicare to your employer coverage. Provider networks can also be more limited. Although this PPO allows you to receive care both in and out of network, you'll generally save money by staying with participating providers in network. Depending on where you live, your employer health plan may actually have access to a larger provider network than an individual Medicare Advantage plan. Prescription drug costs are separate. Unlike the employer plan we reviewed earlier, Medicare Advantage plans include a separate prescription drug benefit. That means your prescription drug spending follows its own cost-sharing structure. For this plan, your annual prescription drug out-of-pocket maximum is an additional $2,100. So when comparing plans, it's important to evaluate both your medical expenses and your prescription drug costs, not just one or the other. And finally, Medicare Advantage plans change every year. Insurance companies review their benefits annually, and that means premiums, copays, provider networks, prescription drug formularies, and supplemental benefits can all change from one year to the next. That's why it's so important to review your annual notice of change every fall and make sure your plan still meets your healthcare needs. So which option is actually better? For someone who is relatively healthy and only sees a doctor a few times each year, a Medicare Advantage plan may provide excellent value with its low routine costs and additional benefits. However, if you expect to have significant medical expenses or you have family members who rely on your plan, your employer health plan may actually provide greater financial protection because of its lower annual maximum out-of-pocket limit and employer contributions toward healthcare costs. So before making any decisions, it's important to compare both your monthly costs and your potential out-of-pocket expenses if something unexpected happens. This is something that we can help with. Just provide us with your employer plan's summary of benefits, and we can do a side-by-side comparison with you. Let's talk about one of the biggest mistakes we see people make. If you're still actively working and covered under a large employer group health plan, don't automatically enroll in Medicare Part B just because you turn 65. Remember, Part B has a monthly premium. If your employer coverage is still your primary insurance, paying for Part B may simply mean you're paying for coverage you don't currently need. Another common misconception is that enrolling in Medicare Parts A and B will somehow fill the gaps in your employer coverage. Unfortunately, that's not how Medicare works. If your employer plan has deductibles, coinsurance, or other cost-sharing requirements, simply enrolling in Medicare while you're still covered by that employer plan generally won't eliminate those expenses. There's another important consideration as well. If you enroll in Part B but delay enrolling in Medicare Supplement because you're staying on employer coverage, you'll eventually lose your one-time Medigap open enrollment period. When you later apply for a Medicare Supplement, you may be required to answer health questions and go through medical underwriting unless you qualify for a guaranteed issue right under federal or state law. That's something many people don't realize until they're ready to retire. So what happens when you're ready to retire? Eventually, many people reach the point where they're ready to leave their employer health plan and transition fully to Medicare. If your employer does not offer retiree health benefits, you'll need to take several important steps. First, you'll need to enroll in Medicare Part B, which has a monthly premium. Next, we recommend reviewing all of your Medicare options before making a decision. That's where we help. Our licensed agents can compare Medicare Supplement plans and Medicare Advantage plans available in your area, so you can choose the coverage that best fits your healthcare needs and your budget. In most cases, after your employer coverage ends, you'll have an 8-month special enrollment period to enroll in Medicare Part B and choose either a Medicare Supplement or a Medicare Advantage plan without incurring a late enrollment penalty for Part B. When you enroll in Part B, you have a 6-month window to purchase a Medigap plan, like a Plan G or a Plan N with no underwriting. You also have a 3-month period to enroll in a Medicare Advantage plan. You do not need both of these plans, and you will actually have to choose which path that you want to go. We have other videos about difference between Medicare Advantage and Original Medicare with a supplement on our channel. Please be sure to check those out. If you'll need a prescription drug coverage after leaving your employer plan, there's another important deadline to remember. Generally, you'll need to enroll in a Medicare Part D prescription drug plan or a Medicare Advantage plan that includes credible drug coverage within 63 days of losing your employer's credible prescription drug coverage to avoid potential late enrollment penalties. The key takeaway is this: don't wait until your employer coverage ends to start your planning. Understanding your options ahead of time can help you avoid unnecessary penalties, gaps in coverage, and costly mistakes. Choosing between employer coverage and Medicare isn't simply about finding the lowest premium. It's about understanding how each plan works, what it will cost when you actually need care, and making sure you have the protection you need for the future. That's why we encourage everyone to compare their options before making a decision. At the Senior Savings Network, our licensed agents do these comparisons every day, and our consultations are completely free. We'll help you understand your employer benefits, compare them to your Medicare options, and make sure you're choosing the coverage that's right for you.
Thanks for the breakdown, Elisa. If you need help comparing your employer coverage to your Medicare options, please give us a call. We'd be happy to help, and again, our services are completely free. You can reach us at the number listed below or visit our website at seniorsavingsnetwork.org. Leave a comment below if you're still working past 65 and tell us what you chose. And if you found this video helpful, don't forget to like, subscribe to our channel, and turn on notifications so you never miss future Medicare updates. Thanks for watching, and we'll see you in the next video.